the next question that I'd like to ask you is that, nowadays we find that more and more women are working from home. So when they are working from home, they sit for long hours on the computer, and they also get backache, and because of the posture, some cervical problems also. Any tips for them how they can avoid these problems?
So, ma'am, the reason I would say, in fact, not only women but men also, young men have a problem of backache when they're sitting at home is because they're overworking their lower back muscles without really strengthening them. So, a sedentary lifestyle, whether it is at office or at home, not involving exercising of the back and not strengthening the muscles in the back, the core muscles, really, the lower abdominal muscles and the back muscles, will lead to their weakening. And if you're already having a weak musculature to start with, then of course you are more prone. Unfortunately, the pandemic has made it difficult for everyone to go and work at their workplaces and offices. They have to do work from home. But there are ways where you can actually prevent this from happening, the backache, and that is to basically make sure that you're not sitting in one place for too long. So get up and walk around a bit and come back and sit and do some stretching exercises. And also, since your back is overexposed, your neck is overexposed to long hours of strained work, so make sure you strengthen that part. So focus on building the muscles of your lower back, your abdomen, and your neck by exercises, by good nutrition, by good diet.
So, I mean, you suggest they should walk over to orthopedician, learn some exercises, and incorporate those in their lifestyle, doing it like on a daily basis.
So honestly, they don't need to really come to an orthopedic surgeon for that. They just need to be educated about it. They must be aware of this issue. They must be understanding that the reason they're getting their backache is most commonly because of this. I'm not saying this is the only cause. I'm not saying that for by a long shot. I'm saying that they should be aware, because if they're aware, then they can understand what needs to be done. And exercises are available on the net, a dime a dozen. They can just go onto YouTube, or they can go onto some of the websites which show the exercises. If they would like a guide who would tell them what is good and what is not good in the beginning, especially when they have pain, then yes. If the problem has been persisting for very long, or if there is some other issue happening along with the backache, for example, the pains going down the leg, or this, associated neurological symptoms like tinglings and numbness in the feet, or weakness, or generalized body aches or aches and pains in joints, the small joints of the hand or the feet, then of course they need to go to a specialist who will first diagnose their problem, make sure it's not something organic, will rule out, some specific cause for the pain, and then bring them back to exercises if nothing specific comes out. If it's more functional, means because of sitting in one place and because of weak muscles, then they can do it themselves.